Hi, welcome. Welcome back to Partnership Live, our monthly discussion with leaders in healthcare who are reshaping health and wellness in New Jersey. I'm Mariekarl Vilceus-Talty, President and CEO of the Partnership for Maternal and Child Health of Northern New Jersey. I'm joined today by Linda Schwimmer, President and CEO of the New Jersey Healthcare Quality Institute. Linda, thank you so much for joining me today. Actually, this is our second show. So you are our second guest. Thank you so much for joining us with Partnership Live. How are you doing?
I'm great. And thank you so much for having me. I'm honored to be here and honored to be your second show guest. So thank you.
Absolutely. I have such, I read your blog. I started reading your blog and it is so interesting and so personal. You pull in a lot of personal information into policy and what's going on in New Jersey. In November, you had a very funny blog that you went to the doctor and you were getting direct messages. You want to share a little bit of that with us? Because I got those direct messages also.
Okay. I wrote a blog because I was going to my OBGYN and I was going there for just my annual checkup and taking care of myself and actually feeling kind of good about my health. And throughout her office were posters asking me, now I'm staring at the Zoom too, asking me how I felt about my lips and those fine lines around my eyes and things like that. And so then I started, while I'm waiting for her nurse to come in, started squinting in the mirror and looking at myself and starting to feel a little bit insecure. And then I got really pissed off about it. I thought, why? Here I am doing something that's a positive thing, taking care of myself, preventive care. And while I'm there, now it's undermining my self-confidence, which certainly can't be good for me. And so that's what the blog was really about. And sort of the ethics and that fine line between, I understand that we unfortunately don't invest enough in primary and preventive care in our country. I understand the physicians and nurses have to make a living and support themselves, but just that whole line of what's appropriate in terms of marketing to your patients. And so that's what the blog was about. And thank you for reading it and for bringing it up. And I think these are fair questions to ask. And I actually had a good dialogue with her about it too. And I think she's going to stop doing that. But she said that, there is a lot of interest, people of my age. So
yeah, people of our age, absolutely. There's a lot of interest. And I remember emailing you saying, I got the same exact message. And then I got some texts for 50% off Botox. And I started doing the same thing, like, okay, maybe a little there, maybe a little there. So I was happy to see that I was not alone. So, and plus your blog was pretty funny the way you wrote about it. So if you were not currently the CEO and president of the Quality Institute, what else would you be doing?
That's a great question. I love my job and what I do. It's really a dream position for me because I like to be able to look at issues and think about how I can make the world better. And that's really, I have that platform being at the Quality Institute. The honest answer is the Quality Institute really is my second act. I was an attorney. I was in private practice, practicing commercial and bankruptcy law for the sort of act one of my career. And I was really helping people at that very micro level, helping them with whatever stressful situation they were going through with their business and helping them resolve it. But I went to law school to really, change the world. I was pretty idealistic and wanted to make a difference on a larger scale. And so when I was in my late 30s, I said, I like what I do, but I don't love what I do. It's not my passion. And I had great role models in my life, including my father, who was an OBGYN and loved what he did every single day. And I just said, life is too short. And I went back, I got into public policy. I worked for the state legislature. Then I worked for our Department of Banking and Insurance, and then for a health plan. And now here at the Quality Institute. every day I feel like I can make a difference in a lot of people's lives. And so that's really what keeps me going. And so I already did that. I already got to switch it up.
That's excellent. So we definitely hope you don't switch it up again, because you're doing such great work at the Quality Institute. So for those of us watching who are not really familiar with the Quality Institute, we know that you improve quality, safety, and affordability of healthcare for everyone. But can you share a little bit more for our audience about what the Quality Institute is really about and what you do?
Sure. Yeah. So we're in our 25th year of existence. We're small but mighty. We are a nonprofit and we're nonpartisan. We have members, including the partnership. So thank you for that. And we work on initiatives with our members where we have expertise as a staff, and we can also really work closely with our members and their expertise and experience and knowledge of topics. So we can't address everything. So we use data and research, and we look at, well, what are the top priorities for the state and the residents of our state? And looking at those things, we will use data, research, we will convene people, and we are not about just putting out a white paper, for instance. We really want to drive change and make a difference. So, for instance, and I know that your focus is on maternal safety and maternal quality. So, when we started to look at things in maternal care and the high rates of C-sections, for instance, we started to really shine a light on the issue, draw attention to it, and then start to propose policy changes that would really make a difference. We were alarmed by the high rates of, for instance, early elective deliveries, which are bad for both mom and baby, and started talking to the state about, why are we paying for these procedures? Why are we incentivizing them? And I started writing op-eds and blogs, and we talked about it publicly. We're the regional leader for the Leapfrog group, which publicly reports on these things, and eventually got New Jersey to pass a law to stop paying for early elective deliveries. And now New Jersey's at almost 0% on it. So with a focused effort on things that matter, we can make a difference. And we do that beyond maternal issues. We work on a whole number of issues, but that's just one example of where we really take the evidence, we use our leadership, our partnerships, and then we work to make a difference.
That's an excellent example. And while I was working in the hospital, I remember your report coming out, and that being really a point of change for us, saying, okay, how are we going to redirect the care? Let's educate, because it's really about the education and the conversation that's had in the doctor's office, whether it's, oh yeah, you can have a C-section. It's your mother's birthday. She would love that. You don't have to go into labor. It's okay that the baby's only, 37, 38 and 8. It's fine. So that really gave the hospital and the organization the impetus to say exactly what you said. Why are we paying people for this? And the babies, let's look at their outcomes. Are they going to the NICU? Is this really what's best practice? So thank you so much, specifically for maternal care. But so many of the New Jersey residents are not really aware of how you're changing the paradigm and the things that you're doing to impact their care. Do you have another example to share specifically of how you're improving care throughout New Jersey?
Sure. So I'll, and thank you for that. And I'm so glad that did make a difference, like, yes, where the rubber meets the road, really in that exchange with the patient and their care team. That's fantastic. Well, I'll go to the other end of things, really, with end of life and end of life conversations, because that, again, it's such an important moment when having a conversation with your family, as well as your caregivers, and having one that's really respectful and culturally competent is so important. around the end of life, so many different factors come into play, particularly religion and family expectations. And I mean, really so many things that have happened in your life and whether they were positive or negative. And we don't, as a culture, we're not comfortable talking about death.
Mhm.
Unfortunately, it's hard.
Mhm.
It's sort of like we're scared that if we talk about it, we'll bring it on, which of course is not true, but it's just, it is what it is. That's a cultural phenomenon. And so we started a project called COIL, or Conversation of Your Life, where,
Mhm.
and it's a community-based project where we really encourage people to have conversations now while they're alive and active and healthy about how they want to live, how they want to age, and eventually the care that they want at the end of their life. We encourage them to pick someone who they know will be a good advocate for them and to be able to speak for them when they can't speak for themselves. That's probably the most important step in advanced care planning is picking that right person, and then really conveying to them what your priorities are. You know, I would want this if I couldn't, you know, if I wasn't going to be able to survive and communicate, this is the type of care I want. So we provide them with tools and resources and books to read and movies to watch and games to play. Literally, we have, you know, film festivals where we really educate the community on how they can empower themselves and to take this into their own hands and be prepared. And that's something we do through a program called our Mayor's Wellness Campaign. And we do this in libraries, senior centers, after church or synagogue, or, you know, other services. So really all over the state in very culturally different ways and different languages. And it's a program that I love. And so many people have said to me, I use your resources. I talked to my parents about it. I shared it with my uncle and my aunt. And that's really gratifying just to know that it's helping people in such a difficult time.
It is definitely helping people. It gives people the language,
right,
to, you know, to broach that conversation. And then when they do get to the hospital, whether they're end of life or not, they have already spoken about advanced directives. It's not something new to them. And they are not shocked by the conversation, like, why are you asking me this? What's my diagnosis? But they've already had that conversation over a chicken dinner where there's nothing happening. So I thought that was that is a very great aspect for the community to be educated on this specific subject. So when they get to that time, it's not something that is harried, or you're not doing things under duress, and you are able to make a real educated decision very slowly with your family, and you know what the plans are in advance. Can you talk more about the Mayor's Wellness Campaign? Is it in its 15th year?
Yes, exactly. Wow. Right. So the Mayor's Wellness Campaign was started because we know in New Jersey so much happens at the local level, and our communities are so different. We are one of the most diverse states in the country. And we ask mayors to take a pledge to make their community a healthier place to live, work, and play, to recognize the diversity and the different needs of their community, whether it's for their employees or their folks that want to age in place and be able to stay in their home, or children, and everybody in between. We guide them to use local public health data. Sometimes that's hard to get, but it's really important because there's a lot of, when you look at the data, there's a lot of disparities across health outcomes and health status, particularly by race and ethnicity. And so if you're not looking at that, it can sometimes mask those disparities. So we help them do that. We help to guide them to where they can find the information. And then we connect them to both our tools and resources that we have that align with their needs, and then others. We have staff that works on it, and we help them implement low to no cost different programs, such as the one I mentioned, COIL. But then we also connect them to a lot of our members who are in the community who can be good partners for them for larger initiatives, public-private partnerships, whether it's their local health system or an organization like the Partnership that has a lot of education in the perinatal space. So whatever the case may be, we really try to connect them to other organizations. We also connect them to volunteers. We work closely with something called the New Jersey Action Coalition, which is a group of nurses across the state that are looking for volunteer opportunities for nurses to have more experience out in the community. So we have nurses in all 21 counties that are volunteering in our Mayor's Wellness Campaign, which is a fantastic resource for those mayors who, most of whom really have no health background or public health background. Having a nurse, a community nurse to work on your campaign with you is fantastic. So it's all shapes and sizes. Right now, our focus is mental health. The pandemic in particular, we've really seen a need for mental health programs, as well as talking about mental health and programs to really address mental health stigma so that people feel comfortable saying, hey, I need help. Right. So that's really been the focus this year. And we've gotten some financial support from the Horizon Foundation for New Jersey for that work, which has been really great.
Oh, that's really excellent. And that's, of course, mission alignment, everything that we are doing also for the community. So with the Mayor's program, if someone watching is unaware of the program and they feel that that's not in their town, can they reach out to their mayor? Like, how can they get it started if it's not really in their neighborhood?
They can definitely reach out to their mayor, and but they can also definitely reach out to us and say, hey, I'm from this community, and we will look up who their mayor is, and we will start to matchmake and see what we can do. We can say we have an interested resident. Hopefully they're an interested volunteer. Most of this is really volunteer led. The mayor, he or she will tap into people who have an interest, and lots of times they'll involve their public health officer, their recreation department. Again, school nurses are always seem to be stepping up. So it's really a all hands on deck opportunity, but very, very community and volunteer driven.
Okay, that's wonderful. Can you give me that information for the nurses volunteering just one more time? Because there are so many nurses that at this particular time are moving away from the hospital. Some are retiring, and they don't want to be completely out of the profession, and this would be something great for them to do. So we can share that with our followers.
Yes, there's something called the New Jersey Action Coalition, I believe it's run through the New Jersey Nurse Association. It's also affiliated with the Robert Wood Johnson Foundation. And it is a program that is really it's part of the overall strategy of advancing nursing, having nurses have leadership opportunities, and also to be involved outside of the hospital walls in the community in a multitude of settings. And so the Nurse Action Coalition has one nurse coordinator for each county. And then that nurse coordinator recruits volunteer nurses, and they do a bit of a matchmaking program where organizations say, we would like a nurse volunteer for these types of roles. And then the nurses say, yes, that's something that I'm interested in. And they're really looking for things that are ongoing. So not your one-off, 5K, those are okay. But they really want something where the nurse can become a leader in the program, and again, use all of the skills and the training that they have, and then develop their leadership capacity alongside their nursing capacity.
Oh, that's excellent. I'm sure I have a lot of nursing friends
great.
Who'd be interested in doing that, so I'll pass that information on. A little bit ago, you spoke about the disparities, which we are very well abreast of. And we know here the partnership, maternal health, of course, is our priority. Yesterday, I believe in the New York Times, they had an article highlighting that maternal deaths throughout the United States increased by 14% during the first year of the pandemic. from, I believe it was 745, like 750 to 860, specifically among Black and Hispanic women. And I know that we are both working to change that paradigm. And we know that in New Jersey, unfortunately, a Black woman is 7 times more likely to die than her white counterpart. And a Black baby is 3 times more likely not to see their first birthday. And I know both of our organizations are working diligently to change that system and to ensure that there's quality births and outcomes for all. Can you talk to me a little bit about what the Quality Institute is doing to address the disparities in maternal health?
Yes, thank you for that question. And every time I hear those statistics, I get the chills. I really, it's, which is a good thing, because we really, all of us can't be complacent about this. We have to address the issue. There's a lot happening in New Jersey. Sometimes, honestly, it can be a bit too noisy. And so that's another reason why I'm so glad that our organizations are working together, because I think we need to push this and push it faster and really get things moving. We are so very supportive of the Nurture NJ work that First Lady Tammy Murphy launched and really shone a light on. We're also very supportive of the work that the Department of Health is doing through a 7-year grant they got through the federal government. But we need to see the work move forward more quickly, and we need to see it align with the work that everybody else is doing, including what the state can be doing as a purchaser and a payer. And I think that, and that's really where I think we can work together, because we need to empower women's voices, particularly Black women. We need to provide them with the platform and the tools and everything your organization is doing to get their voice out, to share both the positive experiences and the joy, as well as warnings and education about knowing when you're in a negative situation and what to do about it and how to speak up, and to know that, yes, this is inappropriate and you absolutely should speak up. So all of that work is so important, but at the same time, the system really needs to be changing structurally and supporting those pregnant individuals. So for instance, like I said, back to payment, we should not be paying more for poor quality care. We should be paying more for high quality care. We should be, and I just wrote an op-ed about this, we should be paying more for the primary care providers, including the OBGYNs and the nurse midwives that take care of people throughout the state, particularly those who are uninsured or those who are insured through our Medicaid system. We need to be investing in those providers and paying more for them, so that they have time to have these meaningful conversations and interactions with their patient, that they can have meaningful visits where they're integrated and they have maybe social work support help, or maybe mental health consults, as well as all of the rest of the prenatal care. There's a program called Strong Start, where we have centering. I know you guys have been involved in that.
Centering pregnancy.
Centering pregnancy. So Medicaid started paying for centering pregnancy, but it's just a few dollars a visit more. It's really, it's nothing. It's not adequate when you think about everything that goes into a centering visit, which is multiple hours long. So I don't mean to ramble, but I just feel like there's so much more that we can do, and it's great to talk about it. It's great to launch this campaign and shine a light on it, but we also need to align how we publicly report quality, and we also need to align our payment system. We have a lot of different levers, and they need to all be rowing in the same direction for us to make a change faster. I don't want to hear about these statistics year over year over year. I really just want to see them go down. I want to see the disparities close. We need to work harder and faster, but all in the same direction. And I think if we do that, we can make a difference, like other states like California, where they really have tackled this much more quickly, because it's a very focused effort.
Yes, I agree with you. And I'm so happy that you brought that up, because that's one of the things I wanted to discuss with you about the reimbursement. I know that when I go to my OBGYN, she has a sign right at the front that she does not accept any Medicaid payment. And as you've discussed, we understand why, because they get like less than half of payment. So you would have to see so many people, and of course, those visits would be 10, 15 minutes. You can't spend the quality time with the individual as much as you would like, as opposed to in California, what's happening. And I believe also in Michigan, they have started a program specifically for BIPOC women with Black and Hispanic midwives and doulas, and getting them reimbursed at a livable wage, that they spend at least an hour with each patient. And when they see the patient, they're not only talking about the obstetrical care, they're looking at any comorbidities, they're looking at diet, and they're also looking at the family dynamics to make sure that they're seeing the patient as a whole, which is so important. So actually, my question is, do you feel that this increase in deaths with the pandemic, the first year of pandemic, do you feel that it had anything to do with the lack of Medicaid reimbursement?
That's
a little far-reaching.
Yeah, no, that's hard to say, but I'll take a step back. When I look at the quality measures for our Medicaid program, particularly prenatal care, we are in the bottom 2 quartiles, meaning that when you compare New Jersey to the rest of the country for Medicaid, so I'm not even talking about comparing us to somebody who's got a fancy plan from their large employer. I'm talking about New Jersey Medicaid beneficiaries versus the rest of the country. We are in the bottom half when it comes to prenatal visits in the first trimester. So why is that? I think it's because we don't have enough providers that are participating in the Medicaid system. I think it's wonderful that throughout the public health emergency, people have been able to stay covered by Medicaid, because that means they've had theoretically access to healthcare. They have a health insurance card.
Right.
But I don't think that our network of physicians and nurses and providers has grown exponentially. The number of them that are willing to take people. We have 2.1 million people now enrolled in our Medicaid system. Yet when we're in a wealthy state like New Jersey is a relatively wealthy state, and we're in the bottom half when it comes to prenatal visits, something's wrong. When we look at other quality measures on that dashboard, something's wrong. We don't have the access that we need. And when I look at the data that's available, we're paying about 50% compared to Medicare rates for OBGYNs and nurse midwives. Why is that? And then when you look at who's served in the Medicaid population, it's predominantly people who have self-identified as being in a racial or ethnic minority. So there is a structurally racist element to this. We need to change that. Why do we pay half compared to the other types of insurance? And this is a really proven like time and time again, a really valuable, it's primary care, whether it's general pediatrics, family medicine, OBGYN,
it's all about
all of these services are proven to improve healthcare, improve equity, improve population health. These are the things that we need to invest in. And this is not the expensive part of healthcare. This is the part of healthcare that makes the most sense. It's penny wise, pound foolish not to be putting the money in this, in this type of care. So I really hope that as we continue this conversation together about, how do we improve outcomes and stop seeing these horrible statistics, that this is a really important step in getting there, is to really make sure we have this foundation of care. Everybody should have a trusted healthcare provider that is going to spend time with them, that they feel comfortable with, who's of their community, who knows them, who respects them. That's really what we need. It's not too much to ask. It's not.
No, I don't think it's not. It's not too much to ask at all. And I know that we are on that road. It is a little slow. New Jersey is the second state in the nation to extend Medicaid coverage past postpartum, so 365 days after birth. So yes, there are positive things happening, but the wheels of change are definitely moving a little slower than they should, I believe.
Yeah.
So thank you.
We're excited about that postpartum coverage. I think that'll make a big difference, but we need to have the providers compensated so that they'll be in the network to see everybody when they're now covered for the full year.
Absolutely. And to make sure that we have a comprehensive delivery team. So we're talking about OBGYNs, midwives, and doulas, because we know that doulas absolutely make a difference. Having those community doulas to be the advocate for the patient and teach the patient how to advocate for themselves is very, very important. And I think that we're moving in the right direction, without a doubt. So 5 years down the road, what do you envision maternal care in New Jersey looking like? And what improvements have we made?
Well, I'm an optimist, and now with you at the helm of the partnership, I'm even more optimistic. I agree. I think we are making a difference. I think that the commitment from the state is helpful. We're launching in the state through that grant I mentioned through the Department of Health, the shared decision-making program. I think that's going to make a big difference, because that is really a very structured, it's called Team Birth, and it's a really very structured program that makes sure that the pregnant person's voice is at the center and they're part of the team and the discussions about the process of laboring and what's going to happen next. So I think that that's really about culture change. I think that'll make a difference. If you and I keep pushing on these other things,
which we will,
I think that 5 years from now, we are going to see that we have reduced those disparities in morbidity and mortality. We're going to have more transparency so that hopefully patients can have better information out there to make a decision and start choosing their hospital and their healthcare provider team. We'll have a proliferation of trained community doulas. We'll have more open-mindedness about midwives practicing within the hospital and more welcoming environments for them. And I think all of those things will really make a difference, including the option for and payment coverage for home births. So yeah. I do think those things are coming. It's a culture change. I see it year over year. When I started working on this, and I'm sure you've been working on this even longer, the conversation was around blaming the women and why, and this is what
Mhm.
women want, or it's, it's their health status, is
Right.
the whole conversation was whether or not it's the women's fault. And,
Exactly.
and that doesn't, I don't hear that hardly ever, which
No, because now we're educating people on their rights and what to ask and what to demand and what the expectation should be. So I do believe with all of us working together, 5 years from now, it looks very bright and very, very different. Very bright and very different. I mean, I can talk to you for hours about this. So interesting. I love, the fact that we together with other agencies are definitely changing the paradigm for women, children, and families to ensure that they are healthy and they are living their best lives. So I know we're running out of time, but my very last question is, the pandemic has brought about a new normal. So what was one of the positive things that came, either life or work balance, that changed your new normal?
It's been a really tough time for everyone in very different ways. Because my office has been 100% virtual since March of 20, it's been interesting that it has really blurred the lines of family and work. And I feel like, in a weird way, even though I haven't been with people physically, we've really gotten to kind of know more about each other and sort of some of our personal needs and struggles and family life. And I think it's made us all more sensitive to one another's needs and brought about a closeness that we didn't have before in certain ways. And that's, and maybe a little more patience for one another in just sort of the fact that my organization is almost all women and many of us mothers. And so it's, that balance, we always, it's a juggling act. But so I think we've become more patient about each other's, juggling. We're also having a baby boom. We have 3 new babies in our, so that's
wonderful.
Yeah. So that's been, I think that's been a positive, at least for us and for me.
Oh, excellent. Excellent. Thank you so much for taking time to speak with me about how you and the Quality Institute are really reshaping healthcare for all of our New Jersey residents. I appreciate your time, and I look forward to working with you and speaking with you soon.
Thank you. Thank you so much for having me. It's been great.
Thank you so much. And thank you for joining us. We look forward to our next, I was going to say episode, or our next session of Partnership Live. So we'll see you next month.